So once again, I want to say thank you to everyone for taking our time to attend this event. Africa Polling Institute is a non-profit, non-partisan, independent opinion research think tank which conducts opinion polls, surveys, social research, and evaluation studies at the intersection of democracy, governance, economy, markets, and public life. Basically, we were born out of a need to begin to create our own local data in this country. Of course, if you've been around for a while, one of the usual things that is said about Nigeria is that we do not have our own local data. And we're born out of that need for us to begin to create local narratives and begin to generate local data that speak to the issues that face us. The Nigerian Disability Research Project was born out of the need to generate data that have to do with people with disability in the country. One of the big challenges that have been identified across the space, and especially within the disabilities community, is that there is limited or a depth of data when it comes to do with people with disability. And so, Ford Foundation had some conversations with us to say, where can we come in? How can we help populate national data on people with disability? And sort of invited us, API, to come and help midwife that process. The process of generating research data on people with disability in the country has 4 key components. The first component is to generate nationwide data on people with disability. And for this, we were to be partnering with the National Bureau of Statistics, NBS, to generate that data. Interestingly, there's a large national survey that's been planned by NBS known as the MIX, Multiple Indicators Cluster Survey. And that's currently in the works. NBS is preparing to go to the field to conduct their MIX survey for 2021. And we have spoken to them, we have engaged with them. We've had several courtesy visits. We've also met with the Statistician General of the Federation, Dr. Yemi Kale, who have given us his word in principle that they'll be glad to include these 2 indicators for disability and indicators for gender, into the documents that they'll be taken to the field. We're excited about that because the MIX study is a 30,000 sample survey covering the entire nation. Of course, for statisticians and for researchers amongst us, we know 30,000 survey is not just that it's a large sample size, but it's robust, it's rigorous, and it's normally expensive to conduct. But for us to have the opportunity to include, indicators for disability and indicators for gender into that survey is a big achievement that will help move the disability community forward. We'll create useful data that will be quoted for many years. If you work within the disability space and you hear most of the data quoted, they are quoting UN. Of course, we're talking about the Washington Group study sets. That's what we're talking about. There's been very little about homegrown, home-based studies. So that's the first component, working with NBS to generate nationwide data for people with disability. The second component is working with a group of scholars to, also collect data, especially at state levels, on a number of indicators. One is the state of PWDs at the state level. What are the current most pressing issues or challenges facing people with disabilities in the state? The second is to understand what state governments conceptually understand by disability. The other to be observed here is what are the existing challenges or the barriers hindering the domestication of the Disabilities Act, especially at the state level, and what can be done to mitigate those barriers. Of course, there are barriers. Since the passing of the Disabilities Act at the national level, not many states have taken it up to domesticate at the state level. And part of this project is to look into those barriers and see how we can find solutions to the domestication at state level. The third component of the disability research project is capacity building for CSOs within the disability space. We understand that one of the huge gaps that exist in the space is having people with disability trained on how to conduct robust quality research. Of course, research is not an easy or all-come affair. You need some level of skill to be able to conceptualize research, to be able to understand what methodology works, where, when, and how to apply. And Ford has also asked that we organize some capacity building sessions to train. So we'll not just conduct research and go home and sleep. No, we'll conduct research or we'll train them and we'll monitor them over time to see how they are putting into practice what we have taught, how much research efforts have come out of that process, how many of them have gone ahead to begin to conduct research. The component that has to do with sexual and gender-based violence against people with disability. Of course, COVID-19 happened in 2020. There were anecdotes of all manner of things that happened, gender-based violence in homes and all of that, that were fallouts of the impact of having people stay at home and, the lockdown, no palliatives, and all of that. And it's important that we get down to understand what people with disability faced within the different clusters that they operate, and see how we can put down some recommendations of what needs to be done to alleviate and to mitigate such situations.
So, my name is Ekaite Judy Tomo. I am the National President of the Joint National Association of Persons with Disabilities. And I want to say what is happening here is a very good thing. And in Nigeria, a disability research project, I want to believe it will bring about a more constructive engagement within this space, so that when we are engaging in advocacy, all the informed decision will be taken will be evidence-based, as it were. I just came in, I thought I heard Prof saying we're going to build capacity of DPOs or disability organizations to do this, because that just be excellent for us, because if it comes to advocacy and speaking for ourselves, I think we are very good at that. But then it came to using evidence-based informed approach to doing those advocacy, we lack better to do that. So I want to say this is a good thing. And the Joint National Association of Persons with Disabilities identified this project.
We, the Deaf Association in Abuja, we've not been collecting data, but I feel API will support more survey in most of the projects. So this, we will work together with API to bring data more to improve the deaf persons in Abuja. We are also going to support, we are going to support this project by God's grace. Thank you.
We associate ourselves and collaborate with API on this very wonderful project, and whatever we can do on our own to support this project. I want to congratulate you for bringing the best and the brightest within the community on this table. On this table today, you have the best and the brightest. Led by our able president, we two of us have a way of fighting and reconciling. If you get into our ways, you will hurt yourself. But with that said, please remember that data is life. And for us to make progress in this community, we must embrace every opportunity to associate ourselves with numbers. Not just numbers, but numbers in disaggregated format, in qualitative and quantitative format. And I believe that with the wealth of experience of API, we will get that. So you started well by ensuring that you carry along the umbrella body of the disability community. I will also humbly advise that you involve most persons with disability in the project, not just as mere partners, but as consultants. The same way you pay your consultants in the field, I think persons with disability who are knowledgeable. We are asking for this on merit, not necessarily because we have disability, and there are very many brains that can also help you drive this process. And I would want to publicly say the whole guided mom by her tail. She has what it takes. Chris and some of the people on this table can really deliver on this project. I publicly endorse that.
I count it a great privilege to be here this morning. And I want to say that INEC is very happy to be associated with API. Disability data is something we've been battling over the years, because as a commission we don't really have disability disaggregated data. But we decided to drive the process by engaging a fifth organization of persons with disabilities to work out strategies on how we are going to generate data of persons with disability. At the end of the day, we came up with a checklist which were used by Inclusive Friends Association. And that same checklist we shared with our ICT to ensure that as we start our CBR, disaggregated data of persons with disabilities will be gathered at the field. And we have what we call from ECH fund. We've been using it on the field, but with the meeting we held with Organization of Persons with Disabilities, the checklist is going to help us during the CBR. We're planning to start by June 28th to gather data of persons with disabilities across the state. I heard you say, talked about training of persons with disabilities. And I think we should probably extend the training to NDAs, commissions. Because you find out that in some of these NDAs, they don't even understand what disability issues are all about. So when you train them alongside the persons with disabilities, it will help you have a good result at the end of the day. So with that said, I say thank you for organizing this program. Welcome once again, and God bless us all.
But with this initiative, I'm really happy when I listened to Prof talking about the objectives. I was really happy that he made mention of something that will involve extending and building the capacity of persons with disabilities. Most research that we have in country, excluding the DHS, which was done in 2018, that talked about the use of Washington group of questions, a little, and got the data at 8%. Other research within the disability space has been more of qualitative. So this particular work is an innovation that is unique, and we are very, very grateful for this. And going forward, we are happy that you are also going to be working with the MBS, which is very, very key. So, like Pastor Jake has said, in the training, in the collection of data, let persons with disability be involved. Because there is a saying among us, we the disability community, there's nothing you do for us without us. We need to be there. So thank you so much.
This is a welcome development, and I would say an impeccable timing that this is coming at this point in time. For a very long time in the Nigerian community, we've been struggling with data. We we go to advocacies and we brag about our numerical strength and all of that. And when they ask us, where is the data to back all of this? All we've ever done is to project. We just quickly go back to WHO 2011 report, which says blah, 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 blah. And so this is the very first time that we're going to have this kind of indigenous research. And we are actually looking forward to it. We believe that the outcome of this research will help us to have some kind of constructive engagement. And so we'll be engaging both the demand and the supply side from an informed perspective. Data is everything. And data is for planning. And if we don't have accurate data about the situation of persons with disabilities, it's going to be extremely difficult to even implement the Disability Act. So I just said this is a welcome development, an impeccable timing. And for us at JONAPWD, we say yes, yes, yes to this project, and we are going to give it all that we can to ensure that we have a very successful project.
And how do you think the findings from this research will bring about a more inclusive society?
And that's what I just told you about, that data is life, everything about planning. I mean, you need to know what it is for people with disability, maybe in the healthcare sector, access to health care. What is the statistics? What is it that is happening in the healthcare sector that we are not able to benefit? How are we even keen into the development, sector as it were? So I think the findings, we give some kind of informed directives. And so when we are engaging in advocacy, we are going to be using those findings to engage, as it were. And I want to believe that, like someone just said in the hall, we should involve all MDAs, those on the supply side as well, so that the outcome of this research will be put to use. So I think when we have a clear data, we have clear information, then planning will be very, very easy, as it were.
Thank you very much.
We're proud to associate with this project, knowing fully well the people behind it. Prof and his team are wonderful people, honest and straightforward, but committed to whatever they do. And so we are hopeful and trust that the outcome of this project will be excellent, beneficial to the community. This is one of those projects that reached out to the right people, the best and the brightest within the community, and like we have received as a promise, and I trust he keeps his word, that the community will be involved, and not just involved, but will be part of decision-making process, so that at the end of the day, the project will be successful. But beyond that, we're going to lend our support to ensure that once the exercise is complete, we will push it through the various systems that we work with, national and international, so that it will be captured at a national level. And I'm hoping that the Bureau of Statistics, NPC, will team up with this process and ensure that these outcomes will be used in every national discourse. Let me make one promise. We have successfully signed an MOU with Federal Radio Corporation. We're going to have a national dialogue on disability inclusion, and it will be in October. So hopefully, if this project is concluded by then, Prof will be one of our resource persons to present it at that platform.
Okay, thank you very much. As you know, data is life. And because data is life, I think one of the challenges that have been found so far that has not allowed the inclusion of people with disability is the fact that there have been little data from the country on people with disability. So with the support of Ford Foundation, Africa Polling Institute was asked to midwife the process of generating national data on persons with disabilities, PWD, in the country. And that's what this project is about. It's called the Nigeria Disability Research Project. And the project has 4 components mainly. The first component is working with the National Bureau of Statistics, NBS, to generate nationwide data on disabilities. The second component is working with academics to engage state government officials in an action research to collect data on disabilities at the state level. The third component has to do with capacity building for persons with disability, especially in the area of research. A lot of organizations within the community want to advocate but they lack the research skills to advocate. So this project is going to help them gain the necessary research skill to be able to do the necessary advocacy. And the fourth component is to conduct a study on sexual and gender-based violence against people with disability. Of course, COVID-19 happened last year, and there were a lot of anecdotal stories and evidences about gender-based violence and sexual violence against people with disability. But this study will be the first study to actually go out there to capture this information on what are people with disability going through, and we'll put that out in the public domain. So yes, we're excited about it, and we want to use this opportunity to thank our donors, Ford Foundation, for supporting this project. And that's part of the project. So for states that haven't domesticated, we are going to be working closely with them to ensure that we domesticate, to ensure that they have, they now begin to implement, because there are a lot of things, even access. They should be given specific quotas for employment, specific quotas for opportunity. Persons with disability need to be allowed, quotas for job, quotas for accommodation, and all of that. For example, at primary school and secondary school level, state government should be paying 100% the fees of persons with special needs. But how many states are doing that? Until we domesticate the Disabilities Act, we will not be able to have that in effect and implement that at state level. So we are hoping that with our scholars, we'll be able to work with state government officials, ministries of Women Affairs and Social Development, Ministry of Education, and especially the Special Needs Department, and Ministry of Youth and Sports, when it has to do with sportsmen and women with disability, and we begin to engage with these different, departments to ensure that we begin to bring the conversation to the fore and begin to push, using data, push for advocacy for the inclusion of people with disability. Well, the significance is that it will be a major landmark for the disabilities community in Nigeria. It would be a huge leap forward, such that disability now have the data nationally generated that they can use to advocate for persons with disability.